620,000 COVID-related deaths. Now, here in the state of Georgia, we have about 983,000 confirmed cases, with about 270,000 of those antigen positives. The difference between those are confirmed cases are generally RPCR cases, whereas antigen are, of course, the rapid test, the more popular test here as of late, because you can generate those results in a matter of 10, 15, 20 minutes. There's really no difference as we separate them between confirmed and presumptive, but the way that we handle those cases here in our district are not different. We handle the confirmed cases and the presumptive cases the same. So just some general statistics here. So we've had approximately 140% increase in the last 14 days of both positive and presumptive cases in the state of Georgia, with approximately 40% of those in the last 7 days. We've had around 70,000 hospitalizations. In total, we've had around 22,000 confirmed and probable deaths. Advance, please. All right. So here as of late, we have seen a large increase in the number of cases in children. So approximately about a 60% increase in those between the ages of 5 and 17, which is important to know because that means schools are back in. Generally, these numbers were taken before schools got back in session. So it'd be interesting to see what this data looks like over the next couple of weeks. Now, 82% of these were 82% increase in our daycare or childcare age group. Now, August the 9th and 10th, we saw a record high in the number of spikes in our ED visits for COVID syndrome among 5 to 17-year-old. So in syndromic surveillance, it's a piece of data that we capture. It captures categories for reasons why people visit the emergency room. Now, COVID was one that we developed last year, which is pretty significant that throughout all of this, that August 9th and 10th was the record high. As you remember, we've gone through several spikes in our community since this began back in January of last year. So it's interesting to know that now we've seen such a spike in this community, especially amongst those 5 to 17. Now, hospitalizations have increased more, 35% over the last 2 to 3 weeks, and this burden is being felt here even in our community. SGMC has seen a tremendous amount of people hospitalized for COVID in the ICU and on ventilators. Now, nearly all COVID deaths and hospitalizations that we are seeing are among those that are unvaccinated. We talk with the local hospital, the area hospitals here often. Truly, we talk to them daily. And the vast majority of those that they're seeing are in that unvaccinated category. Okay. Oh, I'm sorry. Next, please. Okay, there we go. Thank you. All right, so this is just kind of a snapshot of what we're looking like case count wise amongst our 10 county district, as well as the additions of Coffee County and Atkinson County. What's interesting is we for several weeks have been sending, for several months have been sending out a district-wide kind of a snapshot of where our cases were looking like. So about 4 to 6 weeks ago, we were averaging anywhere between 100 and 120 cases per week. Here, as of late, over maybe the last 7 to 10 days, we have been averaging close to 250 to 300 cases per day. So we have seen a significant increase in the number of activity of COVID cases within our community. And unfortunately, it doesn't look like that we've really peaked yet. Could you please advance? All right, Dr. Gross.
All right, thank you, Ken. I'm going to pull my mask down so I can talk better a little bit and I can hear myself better. And the question, what Ken just talked about, this time, this is a surge of the unvaccinated. 90% or more of the patients going in the hospital, from children to 59 years of age, the highest number since this pandemic began in the United States a year and 8 months ago. And therefore, it's a surge of the unvaccinated. How do we overcome this pandemic? I'm just going to give you a little bit of history here. 60 years ago, there was a disease called polio. Right now, your kids can't go to school or college unless they have proof they've been vaccinated for polio. I happened to be brought up around in the 1950s. My grandfather was a general practitioner in a small town in South Georgia. He vaccinated me in 1955 with Salk vaccine on a sugar cube. And at that point, we, during the summers in the 1950s, would not go to church, would not go to public swimming pools, would not go to movies. We would not get around large crowds because we were afraid we would get polio. And I actually saw this in an aunt of mine who's 35, athletic, beautiful lady who got polio, was paralyzed after that for the rest of her life from her waist down. She went to Warm Springs, that's where FDR went when he had polio, and he was also paralyzed from the waist down. And we were then vaccinated for polio. By the 1950s, it had become the most serious communicable disease in the country, just about. And alone 600,000 kids were infected. And the United States, as I said, began vaccinating in 1955. And the last case we've seen of polio in this country was in 1979. Now, if you go to the next slide, the top picture shows patients with polio in what was called iron lungs. We didn't have ventilators back in those days. I went to Warm Springs. I saw my aunt who had eventually was paralyzed from waist down for the rest of her life that I told you about. She was in an iron lung when I actually saw her at that point, but of course I had been vaccinated. The last case, I repeat, was in 1979 in the United States. There are some wild cases in the world now, but none in the United States. And how we overcame it? We overcame it with vaccines. Next slide. The diseases conquered by vaccine include smallpox. I was vaccinated for smallpox. We don't even vaccinate in the world today, not just in the United States, but in the world, because smallpox has been wiped out by vaccination. Millions and millions of Native American Indians were wiped out because the Europeans in the 1700s brought smallpox, and it decimated their numbers terribly. It was estimated tens of millions. Next slide, please. That's smallpox in the picture. Other diseases have been conquered by vaccine. Measles, as in the baby here. Next slide. Hepatitis A and B. And on the right-hand side, chickenpox. I actually had chickenpox when I was 10 years old. Next slide. Shingles on the right-hand side and yellow fever. On the left-hand side, and yellow fever. This patient's jaundice, the whites of his eyes turn yellow. We may not be able to conquer this with vaccines, but we can markedly lessen the risk of sickness and death, much like influenza vaccine. Next slide, please. COVID vaccines. How many shots? Pfizer, 2 doses, 21 days. Moderna, 2 doses in 28 days. We really are not using J&J now. Who can get it? Pfizer, 12 years of age and older, and Moderna, 18 years of age and older. Who should not get it? People with serious allergic reactions. Serious means primarily life-threatening. And when I say that, it's not uncommon to get a day or so of sore arm and not feeling well. Serious could be something we call anaphylaxis, which is systemic and life-threatening. The risk of that, and I'll say this again, is like 1 in 150,000 vaccinations. If you're pregnant, it's recommended that you get either Pfizer or Moderna. What are some of the common side effects? We'll go to that shortly, but fever, tiredness, headache, soreness, and anaphylaxis is the worst thing. But again, I'll reemphasize, one out of, it actually varies which study you look at, 1 out of 100,000 to 200,000 risk of that. Why are the vaccinations so important? To prevent or reduce disease. It outweighs the risk of the disease itself. Reduce spread of disease to others, prevent hospitalizations. The Delta variant is the predominant variant right now in Georgia and the United States. The Delta variant started in India and came to the United States about 6 months ago and has become the predominant strain since then. I will tell you about the Delta variant. The Delta variant is much more transmissible, 2 to 3 times, and young people get it, and particularly, again, the unvaccinated. Even those who are vaccinated can get it. You're going to see some breakthrough infections almost with any vaccine. There's no such thing as perfect. There are autoimmune disorders that they just started the booster vaccination for, you may have heard about. but it's still at least 90, depending on the study, to 95% still effective against the Delta variant. That's getting if you got vaccinated. COVID vaccine development, next slide, please, came about rapidly because prioritization, collaboration, advances in vaccine technology, tens of thousands of volunteers to try out the vaccine, large-scale manufacturing, and funding from government and other sources. Next slide, please. COVID vaccine side effects, primarily on the right-hand side, they're short-lived and occur most commonly within the first few days. Fatigue, muscle pain, joint pain, headache, loss of smell and taste, GI symptoms, sore arm. A lot of people never get any of these. For example, I didn't, which worries me a little bit. I hope I've got antibodies. I haven't actually gotten it checked, and that's how you would check to see if I've got that. How are the vaccine side effects treated? If you're concerned, please see your healthcare provider, but of course, it's generally treated with very Tylenol and rest and just a little bit of time. Should the side effects be reported? When you get vaccinated, you automatically go into vaccine side effect reporting system on your iPhone. Next slide, please. The COVID vaccine, how effective are they? Pfizer, 95% 7 days after the second dose, and Moderna, 94% 14 days after the second dose. How long will immunity last? If you look at this right-hand slide, this actually has been out about a week. This happened in a study that was done in Israel. What you will see here in this slide is that the antibody level drops towards 6 months. But if you look at I guess you would say orange top line are the unvaccinated, the green middle line are vaccinated, and dose 3 are booster doses who have the lowest recurrence of all. So that's data for mRNA in people over 60, first to get vaccine boosters, and that's what that slide is about. Next slide, please. This came from Tift Hospital last week. Just to point out, the dark figures are unvaccinated, and there were 79 hospitalized and 13, the reddish orange, 13 vaccinated versus 66 are unvaccinated, 14 in the ICU, 0 vaccinated, 14 of those on ventilators unvaccinated. And so there have been about 4 deaths in that period of time. Next slide, please. Ken.
All right. So some common questions that we get as it pertains to getting vaccinated are, can I get the vaccination if I've had COVID? And the answer is yes. We generally just ask that you, if you have tested positive for COVID and you have symptoms, that you remain in isolation, which is a 10-day period from either the date of onset or the date of a positive test if you're asymptomatic or have no symptoms. Once those have resolved, we say that you're okay to go get vaccinated. Now, of course, we get a lot of questions about people that are exposed. So, and sometimes we get this terminology mixed up just a touch, but isolation is specific to people that are ill, and quarantine is specific to people that are exposed. So quarantine people are healthy and otherwise not ill, but we ask them to quarantine for a period of time because they have been exposed. Now, can they get vaccinated? Yes. As soon as their quarantine period is complete, we'll kind of go over some special time frames specific to quarantines just a little bit later on. Now, if I've had the antibody therapy or the monoclonal antibody treatment, which the hospital is providing, should I be vaccinated? And the answer is yes. However, given the fact that you do receive that monoclonal antibody treatment, we ask that you wait for a period of 90 days or 3 months after that therapy ends in order to get vaccinated. And do I still need to wear a mask if I've been vaccinated? And yes, or the answer to that is yes. The CDC does recommend that anyone wear a mask indoors in those areas that are considered to be substantial or high transmission areas. I want to say that of the report that we had last week, all but 8 counties in the state of Georgia were considered to be substantial or high risk areas. Next slide, please.
the COVID vaccine, are there any conditions that would stop you from being vaccinated? And it would, yes, if you had a history of severe allergic reactions to any of the vaccines that you may have received. And polyethylene glycol is a chemical that's used in laxatives. I don't think many of you, if any of you, would be exposed to that. The risk of the severe reaction, as I've said before, and I'm going to say again, is somewhere between 1 per 100 to 200,000 vaccinations. And we do the observation times after the vaccine to be sure that you're going to be okay. If you missed your second dose, maximum immunity cannot be guaranteed. The second dose can be given as late, actually, we got 2 weeks down here. I think you can wait a little bit longer than that. I would prefer you do that than not get it at all. Ken, next slide, please.
All right, so what to do after vaccination? So it should be known that we should define what fully vaccinated means. So fully vaccinated is defined as individuals that receive either 2 doses of Moderna or 2 doses of Pfizer, and it has been at least greater than 2 weeks since receiving the second dose of either one of those vaccines, or 2 weeks after receiving the 1-dose Janssen vaccine. So what the CDC says for fully vaccinated individuals are they can resume activities that they did prior to the pandemic, while keeping in mind that we try to ask that they avoid large crowds, just based on the sheer fact how high transmission is in the vast majority of our communities right now. Traveling in the United States without getting tested beforehand, of course, international travel, preferably based on your destination, there may be certain regulations put in place to whether they require you to get tested prior to entry into their country. The CDC has a great has a great link inside of it that allows you to view the destination where you are traveling, and it does give you those recommendations for whether or not they require a negative test prior to entering in the country. It does not have to quarantine or test if exposed to COVID-19 and are asymptomatic. So the CDC does recommend that individuals that are fully vaccinated and are exposed, there is a recommendation for testing 3 to 5 days after the exposure, and they do ask that you monitor for signs and symptoms and wear a mask while indoors. Of course, those again are in areas of substantial and high transmission, which, as mentioned before, the vast majority of our 10-county district is experiencing high transmission. So for maximum protection, the CDC says, do not abandon all safety precautions. So what are safety precautions? Physical distancing, which is defined by the Dph as 6 feet for no longer than 15 minutes, or cumulative of 15 minutes, excuse me. So herd immunity has not been reached. Now, for our 10-county district, I certainly cannot speak for Coffee and Atkinson County on vaccination, but for our 10-county district, we're hovering around 30% fully vaccinated. So in our 10-county district total, we're looking at about 30% fully vaccinated. So we've got a pretty good ways to go in order to reach that threshold. So wearing a mask when indoors in high transmission areas, physical distancing, avoiding medium and large size crowds, avoiding poorly ventilated public spaces, and washing hands frequently. Next slide, please. All right, so Dph Quarantine Guidance. Oh, I'm sorry. Oh, thank you. All right, so as it pertains to quarantine guidance, all right, so quarantine is specific to those individuals that are exposed to a person that has tested positive and or is symptomatic for COVID-19. So the tried and true is always 14 days since the last exposure. There are what we call 2 opt-out options. So those are, for an individual that gets tested between day 5 and 7 after being exposed and is still asymptomatic and receives a negative test, they may return to work or school on day 8 with a mask while also monitoring for signs and symptoms for the duration of a 14-day quarantine period. Or they can complete a 10-day quarantine, returning on day 11. As long as they are asymptomatic, there is no need for a test, but they must also wear a mask and monitor for signs and symptoms for the duration of those 14 days. Next slide, please.
Again, we are going to finish up this presentation at this point. That was really the last slide. I want to repeat a couple points here. one of which is this is a surge of the unvaccinated. More than half of all hospitalizations in the last 30 days were among those 40 to 69 years of age. And 85% of all COVID-related deaths occurred among those who are greater than 60. So the likelihood of getting disease is much greater, though the likelihood of being terminally ill with it is, of course, still usually the elderly. The proportion of cases that are of this Delta variant now are 80%, and as I said, the vaccine is effective against that. 88, 90%, some say even up to 90, 95%, depending on what you listen to, which study you read. Again, the surge of the unvaccinated this time, we're encouraging vaccination in everybody who is eligible. At this point, under 12 is not eligible. I will tell you that today, the Pfizer submitted to the FDA the recommendation for booster, the data that they've gotten, and they are already giving boosters in Israel, and that was where the slide about the booster is showing the drop in cases as the 6-month periods waned in the breakthrough cases. I'm encouraging everybody to get vaccinated when a booster becomes available. I will get a booster, and I don't think we can say it more loudly than we have. That concludes our presentation today, and we can try to answer any questions that you might have.
Dr. Breaux, Mr. Lowry, thank y'all so much for providing that information for us. And we'd like to hear from Dr. Aris Kochan real quickly about what's going on with Coffee Regional Medical Center. So if y'all could hang tight for just a minute, I do want to open it up for question and answers from our faculty and staff. Dr. Kochan, are you available for a report?
Yes, ma'am. My name is
Thank you for joining us today.
Thank you. My name is Aris Kochan. I'm the Chief Medical Officer of Coffee Regional Medical Center. Thank you for having me today. This is a very, very useful and informational topic. So at this point, the information and the data are all available on the Coffee Regional website. But today, our latest numbers at Coffee Regional, inpatient 68. Out of that 68, I would say 99% are the unvaccinated. I would say that this is the highest number we've ever had. This is considered the third surge. Prior to this, our highest number was 52, but that was within the third surge as well. Unfortunately, age ranges from 20s to maybe 50s to 60s, but majority of the patients that we're having now are a lot younger than the first and second surges. I would say, though, that this variant that we're facing now seems to be more contagious than before, because at this point we're seeing whole families coming to the hospital, not just family members. And I'm hoping, and I echo the sentiments of the gentleman before me, that I urge everybody, if you are eligible, please get vaccinated. Thank you.
Thank you so much. You know, one of the things that we're wanting to make sure our students, our faculty, and our staff are so important to us, and we want to keep you all safe. And so there are things that we are doing on campus to do that, the extra sanitization efforts, making sure that all of our faculty have supplies so that they can clean commonly touched areas in between students being on campus. But there's information or questions that you may have specifically about the vaccine. You may have been hesitant to get that vaccine, so we wanted to give you the opportunity to ask any questions that you may have. So if you will, please type it in the chat, or you can use the raise hand symbol and we can call on you. I have a couple of questions that were emailed to me previously, so just to get us started, I'd like to ask one question is, what is the difference between the different vaccination, and is there one that is safer than others?
I can. All right. The two primary vaccines that we're using are the Pfizer and Moderna. Pfizer was the first one to come out, Moderna shortly thereafter. They both are they're both genetic material that's been modified. Neither one is a dead or killed or attenuated virus. They're just their piece of, oh, take it back, take it down. All right. They're pieces of mRNA. They cannot give you the virus. They cannot make you get COVID. I want you to understand that. They both are effective. Now, as far as the Delta variant, the vaccine was originally against the Alpha original variant of the variant, the original vaccine. And these vaccines are still effective against the Delta variant. I've already said this, 88 to 95% in that range against Delta. Very little J&J Johnson Johnson has been given, is being given at this point in our district. Very little has been given. In my, I got Pfizer because that was the only one we had at that particular point. The vast majority of people in our district have gotten Moderna. Moderna is much easier to keep as far as refrigeration and freezing. It has to be thawed out the day that it's used. They have to know how many cases are coming in, so they got 5 doses per vial. Originally, it was 10 or 11. So you had to, and at the end of the day, if you've not used it and it's been open over 6 hours, it has to be thrown in the trash can. So we have to know, you have to make an appointment, ideally. Now, there have been some drive-ups, but we're asking people to make appointments for that reason, so we don't have to discard unused vaccine because we cannot refreeze it, we cannot put it back in the refrigerator. Either one is effective from that standpoint. And I will say to you, and repeat myself here, the booster is coming. It's already been recommended last week for the people with autoimmune diseases, people who have problems with the immunological competence, and they don't make antibodies the way they should because of disease or because of medications that they have. And I honestly believe that we will see in September at some point that they're going to recommend a booster for those 65 and older, first responders, healthcare personnel, just like they did last January when the vaccines first became available. Thank you.
Thank you. And Dr. Cushion, I believe at Coffee Regional Medical Center, y'all also have the Johnson & Johnson vaccine available.
That's correct. We have all 3. We have Moderna, Pfizer, and Johnson & Johnson.
Okay, so you may be the person best to answer this last question, or this next question, which is how effective is that Johnson & Johnson vaccine when compared to the others, based on what you've seen?
Well, based on what I've seen, so I practice in the office and I practice in the hospital too. I haven't had plenty of people that came in with Johnson & Johnson. I think the numbers are more Moderna and Pfizer. That's why I'm not able to tell you. But at this point, I recommend Moderna or Pfizer rather than the Johnson & Johnson. If you can get Moderna or Pfizer, that's preferable other than Johnson & Johnson. But I'm pretty sure it's more effective than not having any vaccine.
Thank you. And this for whoever would like to answer, how does this variant affect babies under the age of 2?
Yes, we are seeing, I will tell you, we are seeing more kids under the age, including babies under the age of 2, get sick with COVID this time. The actual numbers are actual, when you look at absolute numbers, you're looking at very low numbers like 30, 35, but that when it was 2 or 3. So it's significantly more. However, they're generally not seriously ill. I've read of rare cases in other states where children under the age of 2 have passed away from this disease. We've seen none of that in Georgia that I'm aware of at this point. That's the best answer I can give you right now. Of course, we don't have any vaccines yet for anyone yet under the age of 12. I think we're going to see that. It's Pfizer and Moderna are collecting their data now to submit to the FDA. I think we're going to see that within 6 months, hopefully sooner.
Thank you. Do you have any protection after the first dose of either the Pfizer or Moderna and before that second dose? Is there any level of protection?
About 60 or 70% after the first dose and 95% after second dose.
Okay. There's some questions regarding the booster. You said that is something that's being recommended, or is it available now for those over 65, or just in the talks right now?
It's not available at this point for anybody unless you have an immunological problem, either a cancer patient on chemotherapy or some strange autoimmune diseases. Rheumatoid arthritis is one of them. I can name you a whole bunch of real long medical terms that the body's immune system is either attacking the body itself or does not make antibodies the way it should. So they have immunological incompetence. And that's, now in six, I sort of made the statement a while ago, it's guessing, but based on what I'm seeing now, I think we're good. We will see a booster recommended for the quote elderly, that includes me, by the way, saying that the healthcare personnel and or the first responder, just like they did last year this year in January, in prioritization of those who got it first.
All right, thank you. Kind of going back to the Johnson & Johnson, one of the questions that just came through is if you've had the Johnson & Johnson, and could you also get the Moderna or the Pfizer, since that's kind of the recommendation is for one of those two?
I'm not.
So there is nothing that we have that indicates that we should mix manufacturer. If you've received the Johnson & Johnson, the CDC does not recommend mixing manufacturers, so Moderna and Pfizer would not be recommended. There's only extreme circumstances for where they would recommend that, but that would not be indicated in this scenario.
Okay, thank you. The next question, and y'all, we have a very active chat group over here, so I'm trying to go through these as quickly as possible. But if you test negative for the virus and get the vaccine, then within 5 days you find out you were positive. Once you've completed your 14 days, do you start over with the first shot, or you just go in for your second dose on the 21st day?
No, ma'am, you would go in to receive your second dose as long as you're outside of your isolation period. There have been instances where people have been exposed. Exposure can happen anywhere between 2 and 14 days. So that's kind of a large gap of days between, of course, 2 and 14. So if you've already initiated your vaccine schedule, as long as you're outside of that 10 days of isolation after testing positive, you can receive the second dose.
One of the questions here relates to the fact that in some cases, social workers or teachers have reported the reluctance of COVID positive students to report names of students that may have been exposed in an effort to, make others not miss school or miss events that they don't want to. There's a little bit of peer pressure given that age group. Is there anything in addition to this information that you've given us today that can be shared with others to encourage them to name anybody that they may have been in contact with so that we can follow quarantine procedures?
All right, so if it's okay, I'm just going to kind of scroll up and look at that just so I can cover all of that. That was quite a long question, but yes, so anyone that's been exposed to someone that has tested positive for COVID, we certainly do recommend that they quarantine under the 7, 10, and 14-day model. Failure to do so can only lead to further exposures, especially in a school community where you have such a large group of people that congregate together every day for multiple days out of the week. What we want to do is to limit the number of kids that get sick while attending school. So by not following quarantine guidelines, in theory, you're exposing more kids potentially to getting ill. So we certainly hope that if individuals are aware of people that need to quarantine, that they are reporting, so we can follow up on those and ensure that we keep as many people as we can safe.
And I would just add to that also, y'all, for everybody here at Wiregrass, we have the self-reporting form, and we ask that you or your students make them aware of that so that we can follow our protocols and make sure that we're providing the right information to the individuals that need to be quarantining. So make sure you're using that self-reporting form. Another question, there's been a couple of younger women that have a fear of sterility through something that has come out on social media. Are any studies being conducted? And also, are there any studies being done about any inflaming or causing autoimmune disorders with the vaccinations?
The question was, are there any medications?
It's specific to fertility issues with women. Are there any studies out there for fertility issues?
Yes, and there are studies, and fertility is not affected. That was a University of Facebook School of Medicine misinformation. It absolutely does not affect fertility, period.
Thank you. Another question, are there symptoms that are different with the Delta variant from the original variation of COVID?
So actually the symptoms are pretty similar. There are, unfortunately, there's such a broad number of symptoms that are related to COVID. Rather than just your fever, chills, cough, your upper respiratory symptoms, you can also have GI symptoms, nausea, vomiting, diarrhea, loss of taste and smell, extreme fatigue, and I believe that's the vast majority of the symptoms. But yes, there's a pretty broad number of symptoms related to COVID, none specific to just one person. We've kind of seen it all over the board. But generally those, especially here recently, we've seen a lot that are associated with upper respiratory infections.
Can I add to that though? I think the difference between this third surge and maybe most of the Delta variant is that they get sicker quicker. I think any frontline physician would tell you that this variant now is a lot harder to treat. And once they get into hospital and vaccinated, they get the pneumonia. The doctors are pretty much chasing their tail trying to treat this condition. It's a lot faster, and I'm pretty sure they'll probably tell us that it's probably more dangerous.
Yeah, I definitely agree with that. And in addition to that comment, in reference to getting sick quicker, generally last year we saw people get sick anywhere between 5 and 7 days. It seems like now we're looking at maybe 3 to 5, if not sooner. It's amazing to see how much quicker they are getting ill. Another thing that we're seeing is the number of people that have been exposed that are getting sick. Last year quarantine was recommended for a large number of individuals. What we're seeing now is those secondary cases that we're getting from that initial exposure is getting more and more. This is proving to be more transmissible than it was last year.
Thank you. And looking at those symptoms, are there difference with adults versus children symptoms to look for?
They're basically the same.
Okay.
Severity can vary from patient to patient, but the symptom across the board that he just talked about can occur in any one patient, whether they be a child, adolescent, or adult.
Okay, thank you. Another question, can you receive the infusion if you have been vaccinated and have a difficult breakthrough case?
Can you receive the infusion if you have been vaccinated and have a difficult breakthrough case? So what we're seeing with the infusion is many of our outpatient clinics are actually referring out to the hospital for the infusion for that monoclonal antibody treatment. And they have been indicated in vaccinated and especially in the unvaccinated. And I think there is correct me if I'm wrong, Dr. Groh, there might be a criteria that you must meet in order to be referred for antibody treatment. I could be wrong. But I don't know that that's the recommended treatment for everyone that gets COVID. But that's probably dependent upon the provider that you see.
For the unvaccinated, clearly it would be indicated if you're vaccinated and test positive, then I would personally think as a physician, and I know if I get symptomatic and I'm vaccinated, I want to be treated with antibody. The patients who are being treated with antibody, generally the unvaccinated younger, I've had several of them tell me in the last week they feel better in less than 24 hours after the antibody infusion. So there are, and part of the criteria, as long as your physician, a physician orders have the criteria for ordering it, write that order, go to the infusion center of your choice, get it infused. That's the way the decision will be made by you and your physician, and with a physician's order.
Dr. Koshin, were you adding something to that?
I was just gonna say that there is a criteria for the infusion. It's the amount of time when the symptom was onset of symptoms, and it's very, very important that the patient does not require oxygen. Once the patient requires oxygen already, then the infusion is no longer recommended. And majority of the cases that we've given for infusions are the unvaccinated. And I do urge everybody that once they test positive for COVID and they are unvaccinated, to please talk to your healthcare providers about getting the infusion as soon as possible, because the doctor is correct. Once you get it, then the amount of time that you have to recover is a lot faster than if you don't get it. And we've seen this in cases in the hospital repeatedly. Thank you.
Dr. Koshin, let me also ask you, you mentioned the difference in age between the first surge of COVID and what we're currently seeing now, that it appeared to be much younger age group. Is there a reason for this difference in age now?
Yes, ma'am. On the first surge, it was pretty much the nursing home patients, the elderly patients. And that's what we see, people that have multiple comorbidities. The second were the almost the middle age with multiple comorbidities, diabetes, morbid obesity, hypertension. This surge now, I've had patients that are in their 20s and 30s that are coming in relatively very healthy, no medical conditions, don't even take medicine. The only thing that I could attribute this to is that they are the unvaccinated. People that have been vaccinated, especially my elderly patients that have been vaccinated, even though they come to the hospital and they have, been infected with COVID, unfortunately, they don't have the pneumonia symptoms. The pneumonia symptoms now that we're seeing are the people that are not vaccinated. And a lot of the other cases we have here in Coffee are the people that are not vaccinated.
When you were talking earlier about those that are on ventilators or have succumbed to COVID, what is the average age now for those individuals?
Go ahead.
Oh, okay, I was on mute, I'm sorry. The average age now, the last one I saw, is between 58 and 60, whereas before it was greater than 70. So much younger, and they're much more seriously ill, which means I know locally at one point there were 3 30-year-olds that were on ventilators, 30-year-olds. So we're seeing it much younger and or more seriously ill. It's a much more severe disease in the unvaccinated. Again, the surge primarily of the unvaccinated.
I would add to that in Coffee Regional, I would say that we have people in the ventilator that are much younger than that as well. And we have a lot of people that are in their 30s that are nearing the ventilator if they don't receive the proper treatment. So this surge now is definitely much different than the second one.
Thank you. For those that take an at-home test, first of all, what is the effectiveness of it, and does it test for both variants of the virus, or how do you know it's the Delta variant? Is it relevant that it's the Delta? So what would you say about those at-home tests?
We would mention that we don't really recommend using an at-home test. We recommend that you go to a medical provider to receive testing as it pertains to the Delta variant. So identifying the Delta variant is based on genomic sequencing, which is basically us utilizing PCR tests that our providers use, forwarding to them state lab and doing genomic sequencing, which can be up to a week. It's a pretty extensive test. That's how we know. So what we're doing is we're enlisting providers to submit PCR tests to the state in order to do genomic sequencing, so we can better get an idea of what type of variant we are seeing right now. So when you hear those numbers and percentages of Delta variant, that's where those percentages are coming from the number of tests that that go through genomic sequencing and actually are Delta variant.
And I think I said this, but so far it seems to be about 80% now, the last one I saw for the state.
Are there any suggestions that you would give us physicians on ways individuals can strengthen their own immune system by taking vitamins or other supplements?
Eating right, exercise, and then the other mitigation. As far as any specific medication other than trying to keep yourself nutritionally fit, I don't know of any specific medication at this point. I will tell you that Sharp and Dohme is working on an oral antibody preparation as we speak that you would take, sort of like you would take Tamiflu for if you're exposed to influenza in the first 24 hours after you're exposed to try to prevent you from getting it. The answer is right now, there is no medication that will prevent it. Therefore, vaccine is the answer to your question, vaccination.
Thank you. Another question regarding the booster shot that it was mentioned for the Pfizer and Moderna, I believe, but is there also a booster shot that is being discussed for the J&J vaccine?
Is it booster shot?
None that I'm aware of. No, ma'am, not currently.
Looking through the questions, I think most of these that we have kind of covered, but one question that came through: how many of those hospitalized in this latest spike are school-age children? Do you have any numbers regarding that?
I don't have the numbers. I don't know. I don't have those numbers. I did have some absolute numbers somewhere today with the in the country, but I don't have that in front of me right now. But it was less than 100. So in absolute numbers, you can say a double, but if it goes from 2 to 4, in absolute numbers, that's not a lot. On the other hand, if it's you or yours and your children, it's 100%.
Good point there. And then the last one, unless another one comes in real quickly, of the unvaccinated that are sick, are there any numbers of those that have had COVID before? So in other words, there was some
Yes.
immunity already.
They're called breakthrough.
No.
About go ahead.
He said unvaccinated.
Oh, okay.
So we are trying to get numbers for those people that have tested positive before and are now testing positive again. Unfortunately, that is a hard number to come up with. There's a lot of reasons behind that. A lot of it depends on, all labs and providers reporting positive tests, as well as it's just a hard number to track in general when you're talking about hundreds of thousands of positives, individualizing it to one person and whether or not they've been reinfected. But I can tell you that, at least with my staff, there have been multiple individuals that we have had to interview multiple times because of having a reoccurrence of an infection because of COVID. So yes, ma'am, there are numbers out there. It's just a difficult number to track, but we are trying to work on getting those numbers.
Thank you. And then one question that I realized I missed, what about children who have asthma? There were studies that came out originally with the first influx of COVID that said that it did not impact children with asthma more than someone without it. Is there any other studies regarding specifically children with asthma being more susceptible?
Not of which I am aware specifically, though I can assure you that any upper respiratory infection, any infection, COVID included, is going to cause a worsening of pre-existing asthma in most children. We actually have an asthma clinic. We have over 200 children in that clinic. We don't have a pediatric cardiologist in our area. We telehealth that out with pediatric cardiologists in much larger metropolitan areas. But I can assure you that kid is going to have, no matter the cause, no matter what virus causes it, is going to have worsening of pre-existing symptomatic asthma.
Thank you. Is there any final words that that any of y'all would like to leave with us before we close for today?
If you have not already, please, and if you qualify, get vaccinated.
Thank you.
Please.
Yeah,
Well,
the
Dr.
best thing you can do for yourself is to get vaccinated. I think that's the best protection you can do for yourself right now. Thank you.
I want to thank you, Dr. Grove, Mr. Lowry, Dr. Koshin. Thank you so much. We realize how busy the hospitals, how busy the Department of Public Health is right now. And so for you to have taken the hour out of your day to be here with us and help us make wise decisions regarding our own selves and our families, we certainly appreciate it. Very timely, and the fact that fall semester is about to begin here at Wiregrass. So thank you so much. If there's any additional questions that come in, I would love to be able to forward them to you if they were not already previously covered. So again, just want to tell you all, thank you so much for being here. Wiregrass is going to continue to reach out to the CDC, the Georgia Department of Public Health, and TCSG for guidance to make sure that we're giving you correct information on how to protect yourself, how to keep our students as they come on campus healthy, and to encourage you to be vaccinated as well. Let me also remind you, this is something that I sent out in my email on August the 2nd. We're very thankful that Technical College System of Georgia Qualifying employees may use up to 8 hours of leave to get your vaccination through the end of August. So I wanted to leave you with that reminder. If you have any questions for me, y'all, as you review today's information or you think about it, please reach out and let me know. Again, we have students coming on campus August the 19th, and I realize that you are a key factor in making sure that we remain safe. So if you're missing supplies, any of your sanitation materials for your room, for your offices, please let me, Liddell, know. We'll make sure that you have that, and make sure you're using it. It's up to us to sanitize our areas as students come and go from our classroom, and just making sure that they're using that self-reporting form. Again, thank you all for joining us today, and thank you so much, Dr. Grove. Thank you, Mr. Lowry. Thank you, Dr. Koshin, for sharing your information with us.